I am Dr. Narda Robinson. I'm an osteopathic physician and a veterinarian, and I have been dealing with chiropractic stuff since the 80s. I am, as I said, an osteopathic physician, and there's an interesting relationship there between osteopathic medicine and chiropractic. So we'll talk a little bit about that. And as I went from human medicine into adding veterinary, then I could see that there were quite a few practices from human integrative medicine that were just drawn many times just hook, line, and sinker, willy nilly from humans to non humans. And that brings up a lot of questions. And especially when you're dealing with something like the animal and the fact that they are quadrupeds and not bipeds, and that their spinal mechanics are going to be somewhat different, and their reactions to forces applied to their bodies are going to be somewhat different. And yeah, I mean, with horses, they, uh, in probably still, but more so in the old days, this wasn't something that was questioned. Is using 2x4s and hammers and just kind of knocking that spine around. So there have been lots of questions about how we're going to apply these high velocity techniques to animals, and should they be applied or should they not be applied, and what all is going on anyway. And so as we are considering this extrapolation of treatments that came from maybe hundreds or thousands of years ago, or maybe 100 years ago, or maybe 20 years ago, when we're moving that from the human realm for whom these approaches were created initially, and then applying them across species, there's that need to be lots need to be considered. And oftentimes, what I've seen from the beginning of my veterinary work is that there is not enough questioning, whether it is homeopathy, acupuncture, herbal medicine, anything. And coming from that human profession, I would say that I spent 4 years in osteopathic medical school. We learned, various kinds of manipulation. It's not just like taking a course and saying, okay, yeah, we can do everything here and it makes sense. And my teacher told me. So that's oftentimes the big failing. My teacher told me. And if you're not encouraged to think critically, to think independently, to think scientifically. And if you are encouraged to leave your Western mind at the door or leave your critical mind at the door, just believe what we say because we don't want to show you that we can't back it up. So if you're in that train, possible wreck of believing what people are telling you, even with conventional approaches, you're possibly going to hurt somebody. You're possibly not going to be as effective as you should. And then if you become an instructor, whether it's for said charismatic individual who might have a program and you're just repeating what you heard without ever really considering it and dissecting it for yourself, then you're at risk of perpetuating myths and metaphors and incorrect information. So when we have an approach like chiropractic, there's lots of all that to go around. So let's get started. Who wants to know the facts about chiropractic? Well, it may be that there are individuals that would rather this not be completely known, because if consumers have questions, then what are they going to be told? What are they going to be told when they have health insurance for their animal and they think that they want coverage? So many questions. So we're going to be addressing a lot of that. And you might think, well, chiropractic is based on science, right? I mean, there's a chiropractor on every block. There's courses, there's certifications in chiropractic. It has to be on science, right? You're just moving bones. Well, let's talk about that more too, because you might not even have learned about all this other stuff that I'm going to talk to you about today, even if you've been through, so to speak, chiropractic school. Now, word about terminology. Chiropractic is actually a protected term. And I mean, I've been dealing with chiropractors trying to run that kind of approach, run manual therapy in the veterinary profession since 2002, when the AVCA, American Veterinary Chiropractic Association, launched a drive to get animal chiropractic recognized as a separate profession in Colorado. And I'd been at CSU, I mean, since I started vet school in 93, but this was around 2002. And so by the time the Colorado Veterinary Medical Association had heard about it and CSU had heard about it, Colorado State University, the chiropractors involved in carving out manipulative therapy from under the aegis, under the heading of veterinary medicine. And, so that was their goal, is to carve it out from veterinarians having their own ability to work with their hands, manipulative therapy, and make it so that there was a separate licensing board, separate, part of practice that chiropractors would sit on the board for, and okay, some veterinarians too, and that you would have to get the regulatory authority from this separate institution in order to do manipulative therapy, because before that, our veterinary license allows us to do what we feel needs to be done, and it falls under the heading. So that was my first encounter where I was talking with the Department of Regulatory agencies in Colorado and realizing that the chiropractors had already been having long discussions with the legislators in Colorado and convincing them that it was the rights of animal and it was the rights of the animal owner or caregiver to have chiropractic, and that it was similar to back when the chiropractors in the mid 1900s were fighting with the MDs trying to get the ability to work on people and saying, people need this and children need this. And so they were likening children to animals, and that it should be their right for them to get chiropractic. And so it was a very steep uphill climb to talk to these people that had already been convinced it was based on freedom and rectitude of moral authority in medicine, and that's what should happen. And so it was just really eye-opening. And what I found out was, and this is for those of you that might be facing scope of practice challenges in your state, feel free to contact me, narda@curacore.org, because I have a lot of experience with this. And again, I've been in osteopathic school since the 80s and then practiced since the 80s. So anyway, I realized that it didn't really matter what we would say in terms of the animal's benefits or risks. So it wasn't so much about animal welfare for the Department of Regulatory agencies, at least the people that I talked to. It was more about consumer protection, because that's what it's about. Even your state licensure board is about consumer protection, much more than animal public health and welfare. So animal health and welfare, it's more about public health. So, we talked about the inability of chiropractors to recognize something like rabies. Like, not all horses that are lame need chiropractic. Some might have some kind of communicable disease. If they're neurologic, they might have rabies. There's all kinds of things that could happen, and that can put people at risk. So just FYI, if you want that information, it's important to bring up the public health issue, because chiropractors do not learn about infectious disease and pathology and neurology and all these things like we as veterinarians do, but the regulatory agency people don't necessarily know the difference if they've been wined and dined by the chiropractors before you get there. So anyway, moving right along, here's a poll And this might seem weird to ask you, but it's relevant. So, poll number 1, was chiropractic sent from God? Yes, no, I'm not sure, but I think so. I'm not sure, but I doubt it. So, going to launch the poll, and please participate. So we have everybody here, poll in progress, and select one of the following. Hope you can see that. So 60% have voted. Need a few more. Okay, we're getting more responses. We can just get a little bit more. Let's see. Okay, I'm going to close the poll in about 10 seconds, but we will have more of these. Okay, poll complete. Thank you. Close the poll and share results. Let's see. Was chiropractic sent from God? Yes, nobody said that. 60% about said no. Some people thought, I'm not sure, but I think so, or I'm not sure, but I doubt it. So a little bit of a mixed reaction there. I think that some chiropractors, at least from the original, but even some of the seminars that I've watched on YouTube recently would think that it definitely is very spiritual. So anyway, let's talk about God and religion and chiropractic. So we're going back to 19th century medicine. And yeah, this is when osteopathic medicine came around as well. So it was in response to the prevailing practice of what we would now call heroic medicine. And so, what was being practiced as the mainstream wasn't so great either. And that's why there was this proliferation of non-heroic medicine, um, homeopathy, like naturopathy, like naturopathy, like osteopathic medicine, like chiropractic, and there was magnetic healing and all kinds of things, because what was going on with the mainstream was highly injurious. And I mean, it included the administration of mercurous chloride. So it still even had almost demonologic overtones like ancient Chinese, but it was like you got something in your system that either needs to be bled out, so there was bloodletting. Mercurous chloride would cause like ongoing diarrhea, of course, mercury toxicity, and you were said to have had enough of this stuff, for example, like calomel, and I have bottles of that in my antique medicinals collections. But anyway, you were determined to have had enough when your lips start turning blue, and I mean you're essentially just bleeding out, and you're completely toxic, and so a lot of people died with that, and so the individuals that were inclined were looking for other techniques to use rather than approaches that were really scary. And then we had, approaches like these that you see here, and there were herbs, there were minerals, and some of it was taken from Europe. Some things were taken from the Native Americans. So lots of different things were going on. Now, we're going back to history, and this is where I think that a lot of veterinarians don't realize what they're getting into. They don't realize what they're buying into. And this gets back to our previous talk about traditional Chinese veterinary medical herbs and the link between TCM and COVID and just wildlife trade and just the decimation of species and all kinds of things. It's like if you realized where this stuff comes from, would you buy into it still? Do you understand the origins of some of these ideas that you are just swallowing because you've been kind of dumbed down into this accepting, bot or something, and you're just going to regurgitate what you've been told on a test so you can practice, and then you get certified, and you're certified this or that. Well, what does that mean? And what are the premises on which you are practicing? What is the validity? What is the safety? What is the effectiveness? Did you ever ask to see research? So anyway, even if you do chiropractic, maybe you do or maybe you don't know about Daniel David Palmer, the so-called father of chiropractic. He had a son, BJ Palmer, and who actually came into the profession later, who actually kind of killed his father after he ran into him with a car. And the prevailing idea that you see trying to cover this up out there is that D.D. Palmer died from something else, but he actually died from the injuries from his son running into him with a car, because D.D. was not a good father, and he was somewhat abusive to his children. He was so consumed by his mission about chiropractic that he didn't pay much attention to his kids. So that happens too. Here, the early beginnings of chiropractic. Chiropractic emerged in 1895 and was promoted as a viable health care substitute in direct competition with the medical profession. And as I said, there was a lot of tension. There was a lot of looking for something else. So he was coming up with something else. This was an era when there was a belief that one cause and one cure for all disease would be discovered. Well, not with Andrew Taylor Still, who was the MD that started osteopathic medicine. We'll get to him in a second. So D.D. Palmer's idea focused on the spine, and so trying to hook this historical aspect to current day focus on the spine. So when you go to a chiropractor, what do they treat? Do they treat your little toe? Usually not. So you might say this, that, or the other thing that they've treated, but their main focus is the spine. And then it can go on from there. They might want to sell you a bunch of supplements. They might do muscle testing. We'll get back into that. They might say you need, $200 worth of supplements from X company that was based on all this crazy muscle testing. D.D. Palmer came up with this idea of a subluxated vertebra. So a vertebra that is out of place, that needs to be put back in, which modern instructors that are more scientifically minded will talk to you about. There isn't this thing about the bone out of place. It's just not moving right. But this is another mistake that a lot of people think is real, is that there's going to be something out of place. You got to hammer it back in. So according to D.D. Palmer, a subluxated vertebra is the cause of 95% of all diseases. The other 5% is caused by displaced joints, other than those of the vertebral column. So you see there's always this, and already this magical thinking about the spine being just the center of everything. So that was not the case with osteopathic medicine. And so the linkage here is that D.D. Palmer spent a year with A.T. Still, who was the MD that then went into all this structure function relationships and had learned allopathic medicine, which wasn't allopathic at the time because it was what there was. So it wasn't an alternative, but so he practiced, and I'll get to him in a second. He was mainstream, but then also wanted to come up with systems of medicine that would alleviate problems in the structure, but not focus just on the spine, but with fewer dangerous compounds administered, with anesthesia for surgery, with just better living. But so A.T. Still, Andrew Taylor Still, this is in Missouri, Andrew Taylor Still was educating people. And so D.D. Palmer spent a year with him. And as he has this quote, some years ago, I took an expensive course in electropathy, cranial diagnosis, hydrotherapy, facial diagnosis, blah, blah, blah. Later, I took osteopathy, which gave me such a measure of confidence as to almost feel it unnecessary to seek other sciences for the mastery of curable disease. So that comes from one of the many historical references on chiropractic origins, and then we see that with osteopathic too. I just love looking at the history of this. But he admits that he spent a year with A.T. Still. He got some of the ideas, but of course it was just 1 year, and then he went off because he was finding something else, or at least claimed to have found something else, which is quasi-religion. But anyway, this is Andrew Taylor Still, start of my profession, first profession, osteopathic medicine. He was a physician, a surgeon. He just thought through things from an engineering mindset. He also worked with the Kansas legislature and fought in the Civil War against slavery. And he founded the first school of osteopathic medicine. He's the one that coined osteopathy because at the time he was thinking of, diseases relating to the structure, but what it was and has been and continues to be is a lot about soft tissue work as well. But anyway, so he founded that first one, the American School of Osteopathy in Kirksville, Missouri, which is still, in business, and I think it's called the A.T. Still School now. But he wanted to reform 19th century medical practices, including the administration of these arsenicals, opium, and mercury, and imagined a day when rational medical therapy would take hold instead of this heroic medicine that was destroying people. And in fact, members of his own family died at the hands of heroic practitioners and just things that couldn't save them and that actually harmed them. Here was D.D. Palmer, who had spent a year with A.T. Still, went off on his own, I can do this. And then he claimed divine intervention. So when we go, is chiropractic a gift of God? Well, D.D. Palmer claimed that he was receiving chiropractic knowledge and the insights about the workings of the body from the other world, and in fact, from a deceased medical doctor. And you have references there. Joseph Keating has written a lot. He's a chiropractor, but he's written a lot about the origins of chiropractic, and he has a lot of skepticism about many of the claims. So this was a reproduction of a letter. You can read that online. It's a full letter. So yeah, gift from God, gift from the other world, gift from a dead physician. Kind of an early vaxxer, anti-vaxxer, and so somebody against vaccines, which, I mean, I can understand some of the vaccination concerns from a more rational perspective, but what's relevant here is that the early anti-vaxxer sentiment of chiropractic continues to this day among the chiropractic profession. When I did research into some of these belief systems many years ago, when I was writing articles for Veterinary Practice News and writing on chiropractic at times, I found references that said 30% of chiropractors do not believe in vaccinations for humans, and so that has relevance for children and all kinds of things there. But as chiropractors want to get into the practice of chiropractic for animals, then just be aware that there might be some recommendations they make to your clients against vaccinations, and then that's up to you to educate them. But when I was going on before about chiropractic being a protected term, yeah, chiropractors don't want you using the term chiropractic, even though most people seem to now. If you think you're doing chiropractic, then you should have a doctor of chiropractic degree. So technically, you should more say you're doing adjusting, or I don't care what you say, because I'm not in favor of this approach. Anyways, but just like a chiropractor can't say they're doing veterinary chiropractic because the veterinary isn't a protected term. So I have to say they're doing animal chiropractic. Just like with physical therapy, the nurses would like to protect their domain. The osteopaths would like to protect their domain, but everybody rips off our techniques and calls them their own, and that's another whole story. But anyway, so Daniel David Palmer had once said, "It is the very height of absurdity to strive to protect any person from smallpox or any other malady by inoculating them with a filthy animal poison." So another thing this brings up for me is the fact that although Andrew Taylor Still, the founder of osteopathic medicine, was seeing this more rational medical therapy approach where we could tone down the amount of drugs and surgery and then improve intrinsic health, he was still practicing, he was still teaching using pharmaceuticals and using surgery when indicated. But because D.D. Palmer fractured off so quick and developed his own thing that was brought to him by a dead doctor, he didn't embrace pharmaceuticals. He didn't embrace anything of that traditional thing. And so you see nowadays still how that impacts their profession, because they are not practicing surgery. They are not they are not prescribing medications. Of course, there's naturopathy, which is another whole thing that I won't get into right now. But you see that the beginnings of things filter and inform what's going on now. So there was this anti-vaccination sentiment And then another historical perspective, the Palmers espoused anti-vaccination opinions in the early part of the 20th century, rejecting the germ theory of disease in favor of a worldview that a subluxation-free spine achieved by spinal adjustments would result in an unfettered innate intelligence. And so the more I read about chiropractic history, the more irritated I got, because what Andrew Taylor Still had created from this osteopathic medicine with intelligence, not divine, I mean, maybe he had divinity too somewhere, but with rational thought, that how the body worked, and not having this kind of religious fervor about the spine being so central to things, and that if anything was wrong with the spine, that that's where disease came. So, but D.D. Palmer stole enough of the osteopathic concepts that when I read some of the things that, and how he says it, how chiropractors will say it, it's like, yeah, there's overtones of what I teach with my osteopathic philosophy, but it makes it like, oh, I don't teach it like that. I certainly hope. But because we'll talk about the neurophysiology, we'll talk about neuromodulation, but within the context of what is actually shown scientifically and with evidence and rational mechanisms. But anyway, so this is where, with this spiritual aspect, it's part of this continuing trend, continuing tradition of vitalism. And vitalism wasn't started with chiropractic, but when people discuss it, it goes back, a long ways, where it's more of this spiritualist, this energy based, the misguided notion that people have now with chi as the basis of disease, rather than something that is actually happening in the body mechanistically. So here, with the focus on the spine as being the central idea. So you have this split in chiropractic that a lot of people are actually writing about, between the vitalism idea, the vitalists, and the mechanists, because the mechanists or mechanism-based practitioners are more scientifically oriented, but there's problems with that as well. So the chiropractors are wrestling with this. The ones that want to see the profession move forward, that want it to be more like allopathic or even osteopathic medicine, where it's legitimate, versus thinking that you are doing miracles. And some people are talking about, are we better together or apart? Because chiropractic is one big unhappy family, and you've got serious divisions between these groups. So with the vitalist approach, again, this harkens back. So even today, you've got chiropractors that work on this idea, like the Ministry of the Spine. But it goes back to the 19th century. So D.D. Palmer, the originator of chiropractic, established chiropractic based on vitalistic principles. Anecdotally, the authors of this one paper that I've shown you have observed that many chiropractors who overtly claim to be vitalists can't even define the term. Again, practitioners working in a field that they don't really know much about. Therefore, with this paper, we sought to find the origins of vitalism and to examine its effects on chiropractic today. This mental mindset, vitalism, posits that most diseases are caused by these vertebrae interfering with nerve vibrations, which a supernatural force, and can be cured. Therefore, most diseases can be cured by adjusting vertebrae, thereby removing interference with the body's capacity to heal. The relevance of this today and for animal chiropractic is that by the end of these slides, we're going to get to where there are these claims made about what chiropractic can do that make not that much sense. But if you're still going back to that spine and pushing and doing little things, then that's going to magically clear up a lick granuloma, and that your insurance company is going to pay for that. There are implications in terms of what consumers, what doggies, mommy and daddy, are going to spend their resources on. So, and how much are we going to possibly delay effective curative approaches to animals, even if it's integrative. But if chiropractic isn't where it's at, then you're delaying proper care and possibly proper diagnosis. Okay, so shift to vitalism and become a miracle maker. This is actually a chiropractic philosophy seminar that looks pretty much like a something you'd see on Sunday morning. But so with chiropractic and the caduceus that we see, the savior complex. Yeah. So what are we seeing? Where is all that going? Can we just get our back fixed? So then you have the mechanists. So when you hear the vitalists talk about it, they are not that embracing of the mechanists who are looking to understand what they're doing. But I never really adopted high velocity work. I just don't like it. I don't like to do it because there can be injuries and you can't take it back. It's not like doing acupuncture or massage or more gentle techniques that are in osteopathic medicine like myofascial work, because if you do something and it torques it a little bit too much, that then becomes a problem. And when I was a second year student in osteopathic school and learned that the chiropractors had these cases where people were getting strokes from chiropractic, it's like I never want that on my consciousness. So, or my conscience. So I was just like, yeah, very few and far between, if ever, will I do that. For another example, what's the concern? Well, you have a person who is flexed, so flexed and rotated, and then you're going to do another little push. So again, the physician way to do it, if you're going to do this, is much more localized, so you can just have a quick maneuver and use less force. But the concern here, no matter who's doing it, is that when you are flexed and rotated, and then whatever's going on there, to however much force you're going to use, that is also the position where if you were going to rupture a disc, you'd maybe be bending over, twisting, lifting something, so having more pressure, and then that's where the discs will start to bulge more, or if you're unlucky, herniate. So I didn't really like that either, because I don't want to hurt anybody. And just looking at this now, this is stock photography here. Yeah, probably I would flex the neck more, but you're just going to make a little motion there. I would rather do acupuncture, massage, and laser than that. But look at this. Have you ever gone to a chiropractor and they're going to crack your neck and they say, just relax, and they have your head and they're going to take your chin? You see what's going on here? This could be, I'm not saying that this is happening in this stock photo, but if somebody was going to do that and then you have the patient and you're going to go woo, because that chin makes a nice little lever, that would be a problem. And there's a reason why. If somebody's got your neck and they're going to go like this real fast or that real fast, why you might be concerned, and there's legitimate reasons why you should be concerned. So poll number 2 is thrusting. So thrusting is this high velocity, low amplitude, is what probably the osteopaths coined. So high velocity, you're doing that rapid acceleration, but low amplitude is where you don't want to go woo, woo, like that. So that's where I'm used to saying high velocity, HVLA, high velocity, low amplitude. So is thrusting of the upper cervical spine safe? I've kind of already spilled some beans, but maybe you have different opinions. So feel free to dissent. And there is the poll. Is thrusting of the cervical spine safe? Yes, no, I'm not sure, but I think so. I'm not sure, but I doubt it. So we're getting voting coming in. Thank you, everybody, for participating. You don't have to agree with me, but we'll also look at the evidence, because I don't want you to agree with me just to agree. We'll close the poll and share the results. So 2/3 of you were, I'm not sure, but I think it's safe. 1/3, I'm not sure, but I doubt it. And that's fine. And good for you for participating. And again, I can't tell who's answering what, so this is anonymous. But let's look at this. What's the worst that could happen? Here's University of Michigan. So I could have taken lots of stuff from the literature, but I just wanted to keep things moving and have more of an interaction thing rather than read abstracts, but we'll read some. So University of Michigan Medical Healthline, health blog. Anecdotally, this is from a neurologist. Anecdotally, many stroke neurologists have seen patients present to the emergency room directly from their chiropractor's office with stroke symptoms, and that temporal association can be difficult to ignore. Neurologist goes on, a vertebral artery dissection is a tear. So that's what happens to some. A vertebral artery dissection, it's in your neck here, and I'll talk to you a little bit more about it. It's a tear in the interior, in the inner lining of the vertebral artery, which is located toward the back of the neck. So it is one of the 4 major arteries that supply blood to the brain. So you're there, and it's just same thing happens if you're going down a roller coaster and just cranking your neck around. If you're acting out like Bohemian Rhapsody in a car and you're putting your neck through all kinds of fast motions, you can injure these arteries that are drawing blood from your heart up to your head. And there's these different layers to the arteries. And so if you start tearing those, then you can get a dissecting hematoma, which means the blood is going between the layers. And so when we have something like this, and you can see in the back here where that artery goes around. So this is like looking at it it's looking at you, but when you see this right angle here, that's that vertebral artery, because that is coming up sides of your neck in the bones here, and then it's going to take a right angle and then go into your head. Then the artery is very susceptible to damage and torque, and that's what will be part of the thing that rips a little bit. But there's also been blunt carotid artery trauma. So how many of you have ever been told that before you got your neck popped? And there's also various chiropractic theories, like how central the whole neck is, even if you got something else going on, that, oh, you must free the neck. And so they're cranking on that neck every single time, which makes the risk more, than it would be if you didn't. So, and even we're talking about mechanisms. So the mechanists, they want the science. What makes the popping sound? With your knuckles and all that, what makes that sound? They don't even know that yet. So how does the high velocity work other than maybe freeing some joints? We're not getting bones back into place. We're recovering some movement, and a joint might not be, gapping well at that junction, that articular surface. But what makes the popping sound? There are ideas, but it's not known. Now, for those chiropractors that have wanted to get away from the thrusting and the potential injury, they have this thing called an activator, and you'll see people using this. The blue piece there is a little plunger, and so they'll use it, and they'll have it here, and they'll go bum, 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 all over the place. And so there are courses that you can take where you can thump your little cat or your little dog or your horse, bum, 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 bum. And so it's like, okay, fine. So you're trying to imitate the force, the little focal force on the spine. Good for you. Good for you. You're trying to do that. What does that do? What does that do that having a bigger appreciation of all the muscles, the fascia, the nerves, the vessels, and working with that tissue rather than thumping it? Why aren't we freeing it by these actual means that do so much more? That if we didn't have this religious fervor, whether you realize it or not, about the spine, then we're going to be working in all those tissues that actually are what keep that stuck, keep it not engaging with movement. So there's just so many better ways to treat. But what are you going to do with a horse? You're not going to have them lie on the table and say, okay, flex and rotate, boom. No. And so what are the adaptations that are made? So this is on Wikipedia. And so commonly. So what they do, they may or may not get up on something, and then you get your spine all aligned and you thump. You just put a little thump right there. Okay, so maybe you are motioning that joint. How different is that from what a physical therapist might do to open up that joint? And just another thing I've noticed, just when you see people do chiropractic, how happy are they? I don't know. There always seems to be this like real intense focus, and it doesn't seem to be as joyful as I see when there are the techniques that we use with acupuncture and massage and just a much more relaxed space. So, how do you manipulate a horse's joint? What an animal or veterinary chiropractor or adjuster might say, one joint at a time, and you're just focused and you're going to thump it. Okay, nice. Very, very nice. One joint at a time. Okay, well, is there something else we can do that's better? This is from Journal of Small Animal Practice in 2015. And just for critical thinking perspective, this is trying to see, oh, can we find chiropractic subluxations in dogs that have urinary incontinence and urinary retention? So they're like, oh yeah, we can find that there's issues with the spine and we can name them according to chiropractic terminology in the lumbar spine, and those same dogs had urinary issues. That doesn't do anything. That doesn't say chiropractic works. That doesn't say anything. It means they had some altered spinal mechanics in the lumbar spine. Doesn't surprise me, and that's what we would teach and what I teach: massage, acupuncture, photomedicine, all that. It's just, yeah, there are structure and function relationships, and when there are issues with pelvic organs, there are typically concomitant issues, somatic findings that you can find in the back. But that doesn't mean that chiropractic works. You just named it something. Okay, fine. Now, another thing, just as I'm thinking of it, another disconnection in the chiropractic world is that I've seen so many people misled by this. They go to a chiropractic course, so to speak, an animal adjusting, veterinary chiropractic, whatever you want to call it, course, and they get lots of time spent on human neuroanatomy. And because I know these chiropractors that are teaching this, lots and lots of time. They might even have a human neuroanatomist come in and talk about all these different pathways from the back or something and into the spinal cord and all the different connections. And so you spend a lot of time learning human neuroanatomy. Why? There is no fundamental connection other than some mechanoreceptor stimulation here. It's like a smoke screen because, oh, I learned all these neurologic things, all these pathways and stuff. So what? So what? How can you describe to me, because you can't, how doing this little thing to the back, boom, boom, is changing this whole brain and spinal cord function? We can talk about that with acupuncture. We have lots of mechanisms. We don't have that with animal chiropractic. Sorry, we don't. Here's homework for you if you feel that that is true. Go to pubmed.gov, free online shopping. You can press either or not, but free access, and search canine chiropractic. You will not get one study on the clinical applications of chiropractic. I've gone through pretty much everything there is. Name things, chiropractic subluxation in the back if they have urinary problems. Okay, feel free to do that. And then animals under anesthesia, yeah, you can move their bones a little bit. Does chiropractic work for anything in a dog or cat? Nothing there, zero. So if you think that you are practicing science-based treatment with animal chiropractic, okay, what's the science? How does it work? You really can't explain it to me because there, even, it's just not there for the most part, even for the human. So does it work for anything in a non-horse? You don't know. You can't tell me. You can't verify it. It's not been studied. Why hasn't it been studied? People have been teaching animal chiropractic for a long time. the course that I started and then decided there's nothing here back in 2001, just 20 years ago. There's been time to get evidence. So anyway, then we have animal insurance covering chiropractic. Here, yeah, chiropractic for dogs on a certain insurance website. Daily exercise and play sessions form a vital part of pets' everyday lives. However, while living an active lifestyle may be enjoyable, it requires top spine health and flexibility. More and more veterinarians are now recommending chiropractic care to treat injuries. I'm like, who wrote this? Who did you get to put this out there? And what was their training? And now you're selling a rider so that they can get this. More and more veterinarians are recommending chiropractic care to treat injuries, restore mobility, and relieve pain in animals, particularly in aging pets, working dogs, or those involved in intense obedience and agility training. But the benefits of chiropractic care don't end there. This form of manipulation therapy is also becoming increasingly popular in treating a surprising number of other health problems, from separation anxiety to incontinence, because God sent it, and God's treatments can help treat incontinence and separation anxiety by addressing spinal subluxations. They go on. Chiropractic care for dogs involves undergoing spinal manipulation or manual therapy to move misplaced vertebrae. You ask most veterinarians that are in the mechanist side who are doing animal work, they're like, yeah, we're not, those vertebrae, they didn't go here or there. Because even for the human, we see those things aren't out of place and we're not jamming them back. We don't need a 2x4 and a hammer and a horse. But here you see information, public facing information, repeating these things. Now, so what is our role as veterinarians that are treating or referring? This is why I'm doing this, so that you have some deeper understanding rather than, oh, well, my colleagues are sending their separation anxiety cases to animal chiropractors. You'd think that works. If insurance is covering for it, why not? Well, is it safe? Again, another chiropractic fallacy, because that was this idea from way back when that it's like standing on a garden hose, that if there's any kind of subluxation, that's going to cram that foramen where the nerve comes out, and it's going to just jam it, and then that inner energy, those vibrations that come out of the spine and go to all the different cells, they can't make their way. Well, turns out most of the time there's a lot of room in that foramen, so that nerve is not getting jammed. Anyway, this relieves pain, enables the body to naturally heal itself. There are several symptoms which may indicate vertebral subluxations in pets, from changes in temperament and abnormal gait and hunched posture. Some may not cause pain, these subluxations, but they might result in stiffness and tension and can lead to secondary conditions developing, including problems with muscular coordination and mobility. Here they continue. Here's some of the telltale signs of vertebral subluxations. So, as I say, who comes up with this stuff? Somebody did. Do veterinarians buy into it? Let's look. Canadian Veterinary Journal, 1999. Again, quite a long time ago. Veterinary chiropractic. Could it have arisen here? What do they say about the indications for chiropractic? Oh, idiopathic lameness, intervertebral disc disease. Oh, what? The disc is already having problems and you're going to neck and back pain, wobbler syndrome. Hey, spine is already kind of, not put in place well. It's a little unstable potentially. We're going to just spondylosis, cauda equina syndrome. Yeah, they might have urinary incontinence, fecal incontinence from pressing on the cauda equina. And yeah, in humans, that would be a contraindication for chiropractic, and it's a medical emergency. You're gonna manipulate that. Lick granulomas, again, hip dysplasia. Again, and they even say, this is 1999, urinary incontinence, local sensory or glandular neuropathy, post-surgical rehabilitation. Yeah, after surgery, take them for chiropractic. According to this, performance issues in athletes, show or conformation animals, history of trauma, any organ pathology. Pretty much, if you are breathing, you are needing chiropractic. In here from the American Veterinary Chiropractic Association website, similar things, even seizures, behavior or mood change, equine navicular disease or laminitis, chronic health problems that persist, and so on. So as we near the end of this, who can and should perform animal chiropractic? Well, should anybody? So here I want to just run another poll before we go. What about the safety again? Can have any horses ever died from chiropractic? Let's do that really quickly. If you can vote, do you think that could be true? Do you think it's not true? Can a person die from chiropractic? Yes or no? Okay, good. We're almost there. People have that. Okay, we're going to close the poll and share the results. Horses that died from, yes, and you might have heard of a horse dying from chiropractic. I've heard of horses either on the racetrack or in cross ties dead from chiropractic, and most of you don't know. And that's the thing, is that this stuff should be known. The injuries, I mean, I heard about it even when I was at vet school, injuries to animals from chiropractic. But a lot of times you won't hear of it because you haven't been exposed to it, or you're in a course maybe that's like, no, this stuff is really safe, and that's not true necessarily. Chiropractic veterinary groups negotiate for animal care. So this was back in 2010. This was the second time that chiropractors wanted to expand their rights to practice on animals. And this was a time when I worked with the Colorado Veterinary Medical Association again. And yeah, I got a little award for my work there because it was just crazy. They wanted so much right to do a lot of things beyond even manipulation, because there are things that we'll touch on briefly, like applied kinesiology. So we're wrapping up soon, but this is an article that just came out. So should human chiropractors work on animals? That's a question that we should be vigorously debating, or even not. But problem is, they've already convinced a lot of people by the time you get there. And if you shut it down and say no, they shouldn't, then the things could just run away with itself and say you're just being too restrictive. So that's where the CVMA has wanted to kind of work out guidelines, like we've done with physical therapy and massage therapy. But this is a new paper, 2020, with Kevin Hostler and others, looking at the effects of low-level laser therapy and chiropractic care on equine back pain. And you can look at that yourself as well. Go to pubmed.gov and just look up equine chiropractic. And lo and behold, when they combined laser therapy and chiropractic care, well, low laser therapy itself gave you significant reductions in back pain, apaxial muscle hypertonicity, and trunk stiffness. If you add chiropractic care, there's a little bit more movement because you're going like this to the back. Okay, there's a little bit more movement, fine. You can do that with massage. You can do that with acupuncture. You can work on a lot of tissues much more comprehensively than just focusing on the spine, because we're not D.D. Palmer, at least I wouldn't want to be. But when you look at chiropractic itself, did not produce any significant changes in back pain, muscle hypertonicity, or trunk stiffness. Oh, that's a problem, because we just read a whole bunch of indications that said, oops, we're going to help you with all these things, and oops, doesn't work on its own. Oops, just adds a little bit to laser therapy. Check it out for yourself. Go to pubmed.gov. Animal chiropractic has practically no evidential support. We saw the one clinical study that is out there for horses just published, and it's like, yeah, didn't really do anything on its own. How's it going to treat behavior problems in the horse if it's not going to do anything really for the back much on its own? The mechanisms of action of animal chiropractic as well as human chiropractic remain largely unknown. So this is why it pays to talk about science. It pays to have a critical thinking cap on, even if you go for these courses. And let's not take people's money if it's not going to be for the best use. Okay, well, thank you for your attention. Thanks for being here again, and we'll see you next time. Okay, bye-bye.